Thank you so much for all the support you gave me, guys.
Okay.
Today, I got promoted.
Those who spread goodness radiate happiness to everyone around them. Introducing LOLC Finance Credit Cards. Fuel the goodness in you.
Welcome to LMDtv. Continuing our series on the COVID-19 vaccines, Anushan Selvarajah speaks with Professor Suranjith Seneviratne, consultant in clinical immunology and allergy at the Royal Free Hospital and University College, London.
Welcome to the show, Suranjith. Good to have you with us.
Thanks, Anushan. Thank you very much for the invite. Thank you.
What is the current state of the pandemic in the United Kingdom?
Yes, so at present, there was a big uptick in cases starting from end of November going on to December, and the country was put on lockdown because of the increased number of cases, and the number of admissions were increasing, putting a lot of pressure on it would have put a lot of pressure on the NHS, because we know that January is a time where lots of patients get admitted with other respiratory infections. So the number of cases are more than 50,000 per day, together with at one time, about a few days ago, it was more than 1,000 deaths per day. Yesterday it had reduced a bit, but it's very high.
Now the process of vaccination over there is carrying on at a pace. How do you view the effectiveness of this campaign in terms of getting the vaccine out there?
So yes, I mean, ultimately vaccination would be the sort of one important strand in getting this pandemic under control. 3 vaccines have been approved in the UK, and 2 have been already rolled out. The 3rd vaccine, there's a delay in getting that vaccine. I think the important thing is, as opposed to certain other countries like France, where the vaccine, there's been a bit of hesitation by the people with going for vaccination in the UK. It's been good that people have been taking it on, and they have been going for their appointments to get their vaccination. The problem that has happened at the present moment is that there is a shortage of vaccines, and as a result, the vaccination program has had to change. People who were receiving 2 vaccines, who had to get that second vaccine in 3 weeks or 4 weeks, that has been delayed in a number of people. And the idea of the government has been to try and give 1 vaccine to as many people as possible, rather than, say, if you take 1,000 people, rather than giving 500 people 2 vaccines, to give 1,000 people 1 vaccine.
But Suranjit, you're supposed to have the second dose in order for the vaccine to be effective. Now, how would it work if you give everybody just 1 dose? How long before they are susceptible to the virus once again?
Very good question, Anushan, because I think there has been a lot of debate about this same question. Lots of people have come in and into the process. Now we have to remember, we are dealing with a pandemic. We are dealing with more than 50,000 cases per day. That is, if you just put it into context, there are more than 50,000 patients per day in the UK. And the problem is, if you have a lot of cases, could account in number of patients getting severe disease. And if you get severe disease, you have to go into hospital. It's going to affect the hospital sort of uptake, and it's going to affect the working of hospitals. Actually, the NHS can be affected very badly because other patients also will be admitted. So when you look at that in that context, now we know that a single dose of vaccine does protect to some extent. So from a public health perspective, it was important to protect as many people as soon as possible. It is true, as a scientist, when you look at the information, the ideal picture would have been to follow the exact protocol as laid by the phase 3 clinical trials. That is what we have been taught to do. That is what we advise people to do. But I think circumstances overtook the process here, where the immunization sort of authority in the UK had to come in and had to make decisions, because there is not enough vaccines to go around.
Let's bring it back to the virus itself, Suranjit. Now, there are a number of mutations floating about. The UK has one, South Africa has a deadly one. Even Brazil now, it seems. How would you rate the virulence of these mutations?
Yes. So when you look at, I mean, viruses are going to mutate. That is absolute something that happens. We are dealing with what we call a RNA virus. There are two genetic components. There's DNA and there's RNA, right? All of us know about the DNA. This is a RNA virus, and the RNA virus. So RNA viruses like HIV, influenza, etc., they mutate or change. Basically, they are the letters in their genetic code changed at a faster rate than DNA vaccine. So that occurs, and around 4,000 mutations have so far been found in the virus called SARS-CoV-2. If you get, most of the changes are not very relevant. It doesn't have any effect on disease transmission, disease severity, deaths, etc. But the UK from September, there was a change that there were 24 different changes in what we call the genome of the virus. The genome is the sort of the genetic code of the virus, 24 changes, and a number of those changes were in what we call the spike protein. The spike protein is the one on the surface of the virus which attaches to the cell, because viruses have to enter the cell to be able to survive and reproduce. So there were quite a few changes, and what they have so far found with the UK virus is that it is more transmissible. With regards to disease severity, could it affect the vaccine, etc.? At the present moment, they have, for the UK variant, the studies show that it does not increase disease severity. It does not affect the vaccine efficacy. Those are two important things to remember. Now, when it comes to South African variant, it's a different variant, about the same time, reported in December. It has spread to fewer countries as opposed to the UK variant. And that again increases transmission, that is spread from one person to another. However, there is one change there, which in the laboratory, it appears to affect neutralization by the vaccine. And that is being investigated very closely, because we have to remember that when you give a vaccine, you produce antibodies and white cells against different parts of the virus. If I take a pen, and you assume this is a spike protein. So the antibodies can be against this end, here, this part, and at different levels. So if you have multiple antibodies, they will neutralize, they will bind to the spike protein and neutralize it. Just assume that one of these places change. That is what is meant by the mutation, and that there is a small change here. Still, you can find that the virus, the antibodies will act against the virus, because there are several other places that the antibodies can go and bind. But if it changes at a very critical point in the virus, say if this single change or two changes are at a critical point, then it may influence the neutralization by the antibody. That's an easy example just to explain the process with regards to antibodies and the cells that are in the immune system.
Now, a lot of these decisions are being made based on the information that is being put out there by a few countries that are doing the sequencing and the tests and the trials. But there are a number of countries, Suranjith, who are not giving out that information or not doing the sequencing. Wouldn't the lack of that information affect the decisions that are being made on the virus right now?
Absolutely, Anushan. I think that's important. The important thing for everyone to understand, this is a global pandemic. This is not a pandemic in the US or in Europe or in Asia. This is a global pandemic. Now, we have to remember sequencing is not cheap. You have to spend, so the thing is, countries have to prioritize their resources, because if they go and put all their money on testing and sequencing, then where is the money for vaccination? All of us know how economies, the sort of the global economy has sort of been affected countries' economy have been affected. Certain countries have better reserves as compared to others, so they can sort of go back on the reserves, while other countries are not in that fortunate position. So the issue is then their workforce is not being able to be productive. So there are a lot of economic ramifications that are also coming in addition to the healthcare ramifications. And in that instance, it's just collaboration between different partners in the world to ensure that in addition to, say, sequencing, say, 100,000 in the UK, it would also be good to have capacity to sequence from around the world, that is collaborating with other countries. Because otherwise, you're working in a sort of vacuum. I mean, you have to develop something within your own country and then get it to a certain level. But then it is important to then collaborate with other centers. And this same process goes with vaccination. I mean, you would know, and it's written a lot, a number of different countries have reserved actually, far more vaccines than what they need. Certain countries 6 times their population, while other countries do not have a single vaccine that is available. Through WHO and COVAX, they could get those, they'll have access to certain percentage of vaccine.
Now we're looking at 2021 to be the year of the vaccine. Now, do you believe that we would go back to the way it was in 2019 as opposed to 2020?
That is a hope, because we have still started the vaccination program. We still do not know certain important aspects of it. That is, if we want to prevent and get over this, we have to get what we call herd immunity. Herd immunity is a word that's been used a lot, and herd immunity means just getting a certain amount of the population immune to the virus. So it's about 60 to 70%. Now that's a big number of the population. If you consider 20 million, it's an important amount to be vaccinated. Secondly, it was wonderful that the vaccines are greater than 90% effective, especially the first two, the Pfizer and the Moderna vaccine. The Oxford vaccine was a bit less effective, but there was some other advantage. Now the important thing is, how long will that protection last? That is why I can't give a direct answer. We will go back to, that's the hope, we'll go back to like 2019, because if it is something that wanes off, say in a year, we'll have to get another vaccine. And then vaccines are not cheap. You have to spend, countries have to get it. Can we sustain the process, etc.? There are lots of developments with regards to vaccines. At the moment, it's an intramuscular vaccine, but people are working towards, can we get a nasal vaccine? Because, you can make the vaccine, but ultimately you have to get it to the people. That's the important, that link. Sri Lanka overall is blessed with having a wonderful immunization program, childhood immunization program. We are leaders in the region and in the world. We have a wonderful program. There is less vaccine hesitancy. Mothers take their children, get them vaccinated. We have a wonderful program that is set up. So I think in that way, Sri Lanka is blessed in having a great program there. So when we have a vaccine, when we are able to source it, getting it to the people would be less of a problem, as opposed to some other countries where there's so much vaccine skepticism. There is the sort of getting to remote area is difficult because you have to maintain something called a cold chain for sort of keeping even the Oxford vaccine has to be kept in the fridge. So those are important aspects which people have to think about when it comes to a vaccine. And getting back to 2019, can we all get together and deliver on a whole range of processes in addition to manufacturing the vaccine? Because there's a whole lot of other steps that companies, etc., have to come into play.
We're going for a short break now.
Our story is one of reimagining. Reimagining who you can be, what you can achieve, and how SEMA can support you. As technology and digital platforms disrupt businesses, we are reimagining what the profession can be. We've updated our syllabus to meet the expectation of employers, ensuring SEMA-qualified professionals have the skills to make an impact from day one. Reimagine your career. Contact SEMA Sri Lanka.
Welcome back to the show as we continue our discussion with Professor Suranjith Seneviratne. Now, just before the break, you mentioned herd immunity, and you also mentioned that Sri Lanka does have a great child immunization policy. But we're not talking about the children here, are we, Suranjith? Because they're not even talking about vaccinating those under the ages of 18. How can we not think about the children or the younger generation if we want to reach this herd immunity? Because they could be carriers as well, right?
I think that question has been asked at the moment, Anushan, because when you develop a drug or a vaccine, you always initially test it on adults. I mean, that's the normal process. You generally test it below 60 years. Here, they had to extend the age because the older person was the one that was getting very severe disease. So children were really not tested in the phase 3 trial because you have to do a trial, you have to get your population. So children were not tested. However, now companies are indeed testing children. So at one stage, vaccines will be registered for children. So at the moment it's 18 years, but it will be registered. I think one of the two other manufacturers have gone down and they're doing studies.
Suranjit, most of the countries that have begun the vaccination process are following a standard policy in terms of vaccinating healthcare workers, those over the ages of 60, those with pre-existing conditions, etc. But Indonesia has followed a different path. They've decided to vaccinate the 18 to 59 age group, which is the working population, the ones who will be out there on the road, using public transport and such. Is that a good way to go about doing it, considering that the economy must also be looked at?
Yes, I think that's a very good question. There are many, many answers to this question. It depends on how you look at it, what your perspective is. I mean, I don't think such a process of vaccinating only the working population or the productive population, as you would call within inverted bracket, would work within sort of in Europe or in the US, because there would be an absolute political backlash if that happens. And, it's a different society, and you just can't. I mean, it is the same situation. You would know. I mean, if you look at the British papers, you have a lockdown, but then in the weekend you had people teeming in Hyde Park and different parks, etc. And while in certain other countries that would have not occurred. I mean, initially when there were lockdowns in the countries that first had the COVID and Corona, it was absolute lockdown, and nobody sort of tried breaking and that is why there's push to try and extend the lockdown and make it very strict. So the thing is that Indonesia, they would have taken a step. Yes, you can argue it in that fashion because that is the important thing. Economies are going down. And the important thing is the indirect effects, because people say, okay, people are getting unwell and then they are not being able to go to work, etc. However, because of the closures, because of the multiple closures and the resources being directed towards COVID, you find that cancer care, heart disease, other chronic illnesses are being affected. People can't go for their appointments. People can't go for their investigations. A delay of 1 month in cancer care can have a very important impact. And that is a metric which people do not measure. I'm not that it can be measured. Yes, definitely it can be measured, but people don't talk about it. If you read a paper, it is number of cases, number of deaths. That is the metric that we talk about. Then there is information about the economic impact, what happens to the stock market, etc., and what happens to the to that aspect. But when you look at the other collateral effects on other sort of health conditions, etc., it is an important thing to consider. So the question you ask, yes, certain countries have to decide what is best for them. Lots of countries have thought it is the older population and healthcare workers and social care workers, especially where you have a social, certain countries have a big social care sort of sector as opposed to another, because say in Sri Lanka, they'll be with their children at home, etc. While in many other countries, you'll have this social where they will be away from home. But certain countries will go with the idea, let's vaccinate the people who are working, who are moving around, open up the economy, and then go on to the rest of the population. So I think those are two ways people can go.
With your experience, how should Sri Lanka go about with its vaccination policy once the vaccines do reach us?
If you take the population, so if you take children away, 4 million out of the so 6 million. So therefore, we take 6 million out, then you have about 16 million or so, or 15 million or so, or 16 that you have to vaccinate. Now, of that, the WHO would give 20%, about 4 million. So then it comes to finding the money for finding the resources to get 12 million vaccines. Now, when you look, we all know that medicines have been generally not effective in COVID. They have tested a number of medicines, except for a medicine called dexamethasone, which people know as a steroid, plus one or two other medicines that may reduce hospital visit, but dexamethasone reduced the death rate. Other medicines have not been effective. Can we keep people at home for months on end, not going to work, not going to school, wearing masks? Yes, people should be wearing masks always, keeping them social distance, okay. But then you have to open the country at some stage. You have to get the economy, the sort of wheels moving, because, other conditions are fair. So vaccination has to come in at some stage. How do you source it? I think that if you look at Sri Lanka, I would, at my present, looking at it at the present moment with the 3 approved vaccines, we have to remember 3, I must be careful, there are 3 approved vaccines by the FDA, the European agency, and the MHRA in the UK, because we know that there's a Chinese vaccines and the Russian vaccine. We have to take those into account. We cannot discount it, because often we only just speak about 3 different vaccines. Of those, the 3 that have been approved by those regulatory agencies, the Oxford AstraZeneca vaccine would be a better fit to Sri Lanka overall, because of 2 reasons. Number one is the cold chain. It's a fridge cold chain, and it's a cheaper vaccine. However, I think the present time, many people have asked, should I wait for this vaccine? Should I wait for that vaccine, etc.? The idea is get any vaccine that has been approved properly. That is the important thing. Get any vaccine, because if you get that protection, at least that will be moving towards getting this pandemic under control.
Now, you mentioned that we should procure the vaccines from whoever has to offer them. But the AstraZeneca vaccine gives you a 70% efficacy rate. Pfizer-BioNTech above 90%. And the recent Sinovac vaccine, which is tested out in Brazil, has shown to have a 50.4% efficacy rate. Now, how would it work if you're giving your population this wide range of vaccines with different efficacy rates, where some would last longer than others? How would it work?
Yeah, absolutely. And these are the complexities that are going to come up as we go, because Anushan, in May, we didn't even think that there would be any vaccine. If you go back to May, June, nobody thought that everyone was saying, HIV, we've been trying for years to get a vaccine. So at least now we have got some vaccine. And the issue is that in life, this happens. Always the one that produces the best effect from efficacy may have a downside on some. It would have been wonderful if the vaccines that have greater than 90% were the cheapest, were the cheapest and the easiest to get to different remote parts of the world. But that is life. That does not always align itself. And the problem is that now important medical bodies and not only medical, but I think it should be across important community groups in a country, because it's not only a medical body that decides about vaccines, it is other people can bring in a lot of insights, because the logistics, etc. That's where companies, basically, that is exactly what companies do. I mean, especially the private sector do. Now in the UK, they brought in, there was this vaccine sort of authority. What they did was they brought in the best from the private sector to help to work hand in hand with those in the government sector to be able to roll out the vaccine, because ideas from both sectors are important. People in the private sector, you deliver, you have certain delivery targets and you deliver it, and you know how to get it best. While the government sector, you have other aspects, very good aspects of excellent sort of coordination with regards to keeping record keeping. So the two systems working together should be able to. So each country will then decide, right, is that sufficient? Is that sufficient amount of protection? If we can't get, then I would say, if you can get a vaccine that has 70% now, as opposed to getting a vaccine that is 90% in October, I mean, that's a no-brainer. You will definitely go for the 70%, because you can't wait till October, because waiting till October would not be very effective overall.
Now the layman in us as a final question, Suranjith, we want to know how long it would take for us to reach herd immunity and to stop wearing masks. What's your opinion?
I think it will be in months, because and hopefully it doesn't go to a year. It will be in months, because already we have produced vaccines, but that is not the end, because it has to get to the people. And hopefully the coronavirus, SARS-CoV-2 will not, as we say in cricket, I mean, I love cricket, it won't produce another googly, as you'd say, or another Prof winner, which will get scientists scurrying again. So it would be for months, because even when you get the vaccine, you have to get a fairly big number of people immune to have herd immunity. And during that period, people do have to wear masks, do have to social distance, because otherwise it is you're not. You have a social, you have a responsibility to yourself, and when you live in society, there's a responsibility to others in society too, and that is an important aspect, because if you only look at yourself, okay, I can do anything I want, but then you're living in a society, and a society will not move forward if everyone says, I will do it only, I don't want to wear a mask, so I will do it because I don't want to wear a mask. Then you have to think about society too. So it is, you have to have a global outlook, rather than only, okay, this is what I will do in this small segment or sector.
Well, let's hope that the world keeps working together, as there is no greater need at this point of time. Thank you very much for joining us on the show, Suranjith. It was a great pleasure.
Thank you very much. Thanks. Thank you.
After a short break, Ashwini Vethakan will bring you an update on the global coronavirus situation. Stay tuned.
Welcome back to the show. I'm Ashwini Vethakan, and here's an update of the global COVID-19 situation. As of this week, global COVID infections have exceeded 95 million, with the recovered number of patients being slightly over 68 million. The total number of global COVID deaths now stand at 2 million. UK and Russian scientists are teaming up to trial a combination of the Oxford AstraZeneca and Sputnik V vaccines to see if protection against COVID-19 can be improved. Mixing the two similar vaccines could lead to a better immune response in people. The trials, to be held in Russia, will involve those over the age of 18, although it's not clear how many people will be involved. The US Food and Drug Administration has authorized the Pfizer-BioNTech coronavirus vaccine for emergency use. The agency said the authorization was a significant milestone in the pandemic, which has taken more than 295,000 lives in the US. The vaccine offers up to 95% protection against COVID-19 and was deemed safe and effective by the FDA. India began one of the world's largest coronavirus vaccine programs last week. Indian Prime Minister Narendra Modi launched the program virtually in New Delhi, with around 300,000 people receiving the first of 2 doses on day 1. The UK has closed all travel corridors to protect against the risk of as yet unidentified strains of COVID-19. Anyone flying into the country from overseas will now have to show proof of a negative COVID test before setting off. France and Russia have prepared to beef up their coronavirus inoculation programs next week. With infections surging past 95 million and more than 2 million deaths, and Europe among the hardest hit regions, France and Russia shifted their vaccination programs into high gear from Monday. Australia may not fully reopen its international borders this year, even if most of the population is vaccinated against the coronavirus, the head of its health department said on Monday, as the country recorded 0 local COVID-19 cases. China reported more than 100 new COVID-19 cases for the 6th consecutive day, with rising infections in the northeast fueling concerns of another national wave ahead of a major holiday season. Daily increases still remain a fraction of what the country saw at the height of the outbreak in early 2020, but authorities are implementing an aggressive package of measures, including the lockdown of more than 28 million people, in order to keep the disease from bringing the country to another painful standstill. That's all we have for you this week. Don't forget to subscribe to our YouTube channel and follow us on Facebook and Twitter. Thank you for watching and stay safe.